is something none of us want. And especially when the pain is at the posterior most part of your mouth where your brush, your hand, your tongue cannot really reach. And that pain is really triggering headache and earache. So is this pain due to impaction or food lodgement? Is there any serious issue regarding it? What is impaction? What is food lodgement? What am I speaking? I know you're here for remedies. For that, watching till the end where I'll be giving you solutions for your this food impaction or pain issue in the most back region of your teeth, which is like the last tooth, near the last tooth in your mouth. Let us watch today's video.
Subscribe to my channel Dr. Mansi Shah for oral health related videos and tips.
Hello and a very happy morning to all of you, and here you are on my show Monday Mornings with Mansi and my YouTube channel Dr. Mansi Shah. Friends, what are we going to cover today? What is third molar impaction? What is pericoronitis? Is this food lodgement or pain in the back side of your tooth a serious issue? What are the treatment options and what can you at home do to relieve yourself? Let us not waste time and move ahead. So first thing, what is a third molar impaction? So a molar tooth is nothing but the last tooth which are huge in shape and look something like this in your mouth. So these teeth are the ones which actually help you to bite down. Now we all have or should have 3 molars, the first, second and the third. But now as our era is increasing, our ancient people used to have 3, 4. Now we are moving ahead, the number of molars is reducing. So now we mostly have 1 or 2 molars and the third molar just stays inside. So this third molar which is inside your cavity, that sometimes tries to pop out. It sometimes just tries to come out from the mouth. And when it does not get a chance to come out, that is when we call it as impaction. It is impacted inside. It is just there inside your mouth. A few reasons why this molar has been impacted and it is not coming up. And this molar, when it is partially come up or just trying to come up, it will induce pain. And this pain is mainly because of the food lodgement that's happening. So now if this is the scenario, as you can see in the picture, that there is the second molar and this impacted tooth is at an angle. There forms a pocket, and this pocket, there takes place a lot of food lodgement. Now if this food lodgement continues taking place, that will initiate cavity in both the second and the third molar. So in both the teeth, the cavity will get induced. So to avoid this scenario, we have to treat this tooth. How? We will be watching that. Now, the second question, what is this flap which is present above this tooth? And if this flap is paining, inflamed, become red, or is having some whitish bump which is showing on that flap. So that is a pericoronal flap. So as we all know that before a tooth erupts, there is a bone layer and there is gums which are present. So now if this tooth has teared apart the bone and it has partially come up, what remains up is this gum layer. Now this gum layer is there because it is not completely torn now. It is not completely opened up yet. So there is that flap which is trying to protect that tooth yet. And this flap, because it is forming a pocket, there will be food lodgement, there will be irritation from the upper teeth to that flap. And if that takes place, that is called as pericoronitis. What is to be done? Yes, I will be telling you. So as our basic concepts are clear that why there can be pain or cavity in that last tooth. Okay. Now let us know that is this food lodgement a serious issue and how can we treat it? So yes, this food lodgement can be a serious issue because as I told you, it can initiate cavities in both the tooth. If the cavity is not treated or not noticed, then it can cause infection, and this infection mostly does not initiate If it is mostly the third molar, then it can convert into granuloma and cyst, and it eats up all your bone there, just like as shown in this x-ray. So if that is happening, then your bone becomes weak somewhere, your jawline is somewhere reducing and becoming weak, the bone near that jawline area. That should not really happen. So now when this food lodgement is taking place, your brush is also not able to reach there out. Or if you have already tried toothpicks and cards and all sort of things, yes, you will know that reaching that area is the most tough thing that is happening. So now I'll tell you treatment and at home what can you do. So the first treatment and the most important thing is you should accept it. Yes, undergoing extraction is what you need to do. Extraction meaning you have to remove that tooth. So this is going to be a little surgical procedure, and it might just cause you a little bit of swelling. You will have to take medications for 3 to 5 days post the removal of this impacted third molar. Why is this removal important? Because this tooth, which is angulated, is never gonna come up. You cannot pull that tooth up, or that flap which is there up, that is still gonna always be there. Now in certain cases, this pericoronal flap can also be removed, and you will have to just wait and watch. That depends on the angulation of the teeth and the cavity or the injury it is doing to the head tooth, or the infection, if it is spread or not spread. So if all the things are good positive, then the doctor might just tell you that remove the upper flap and wait and watch. If things work well for you, very nice, good. If it doesn't, then extraction is the only option. Now, cleaning of this at home is gonna be through using betadine wash or warm water and salt rinses, which will help you subside the infection and clean that area in a much better way. Also, when you are brushing, make sure you close your jaw half, like not complete jaw closing, but halfway. And then putting your brush inside, make sure the bristles are very nice and a new brush is used so that you can clean there, and the head of the brush is not without the bristles. Also, you can at times use an interdental brush in a sleeping manner and clean that area, but make sure you don't hurt yourself, or you don't pressurize too much, or the interdental brush, the front bristles are very much weak and they might just break there. Make sure and take care while using an interdental brush. So, this was the video which was explaining on what is a third molar impaction, why there is a pain, and what are the treatment options. Now, for medications, you should always recommend dentist, but yes, if it is not an appropriate time or your dentist is not available, I would say that painkiller that is going to help you reduce your symptoms temporarily. And yes, as soon as your dentist is available, go to them and get yourself treated. Friends, I am Dr. Mansi Shah, practicing in the city of Pune. If you want to reach out to us, have treatment at our clinic, then that's our mail ID. Please make sure that you mail us and confirm an appointment. If you're liking my videos, give a thumbs up, share it among your friends. If you have any doubts, questions, make sure you comment here and I'll be very happy to answer them. Do not forget to subscribe to the channel before you leave. Stay healthy, stay happy and stay over fit. Thank you.